Hey guys, welcome to the second episode of the Hot Pulp podcast. I'm joined today by Jordan. She is a pediatric dentist from America. How are you doing today?
Good. How are you?
Great, thanks. Really enjoying getting these interviews going and seeing what everyone's doing and what everyone's getting up to. So, what have you been up to today? What's your day been like?
Today's actually my off day, so I'm not at work today, which has been kind of nice. So I've just been doing errands and boring things like that. Nothing too interesting,
All right, so
which is
you kind of have like a rest day in the middle of the week.
yeah,
That's pretty good. So, the first things we usually ask on this podcast, or I'm going to be asking, is what's the first thing that got you interested in dentistry? Maybe not the first time you knew you were going to do it, but the first time you were like, oh, I might consider that as a career.
sure. So I've always had an interest in healthcare. My mom's a nurse, so I always knew I wanted to do something in the healthcare field. But when I went to college in a very rural area and spent time in a free clinic down there. And there, I got to see a lot of patients who were really affected by dental disease, and that dental disease then really affected their overall health. So that was kind of the first time I saw what an
Yeah.
impact dental health has over your whole health, and that kind of opened my eyes to it.
So, just for clarification for guys from kind of the UK and other places, the
Hmm.
American system, you go to college first as like an
Yeah.
undergrad sort of thing, and then you decide what you're going to do afterwards.
Mhm.
So, is that kind of useful, do you think? Or because us guys, we have to decide about 14, 15 what we're going to do, and then we go ahead
Oh,
and go for it. Whereas you guys got a bit more time to kind of find out what you are as a person before you dive down kind of this is what I'm going to be sort of route.
yeah. I mean, I don't know. I don't know if at 14 or 15, if I would have necessarily picked dentistry as my healthcare field profession. So I think it was good to have those experiences in college. I know some programs in America, like especially pharmacy programs, not at 14 or 15, but they're starting you do 2 years of college and then you enter the pharmacy program. So I don't know if dentistry in America will do that, but I think it was good for me to have those 4 years to kind of make sure that was really what I wanted to do and get those experiences in. But I don't know. I
Yeah,
can't
so
imagine being at 14.
yeah, I think we kind of you know you're going to have to pick, so you really think about it quite early over here. So it is a bit of a difference in kind of schooling, I suppose. So what was that firm kind of moment where you were like, I'm not going to do medicine, I'm not going to do X, Y, Z, and you're like, this is definitely it. I'm going to apply.
Again, the free clinic was a eye-opening experience, and
Mm.
then here in America we have events called Mission of Mercy because unfortunately the way dental insurance is covered is it's not really kind of a benefit. It doesn't cover too much, especially if you're an adult. So I went to one of those, and there were lines of people for a day and a half before the event camping out just to see if they could have the possibility of getting one thing done, like one tooth pulled or one filling done. And that kind of really inspired me to want to go into dentistry to help people because there's, a big need for it, but also work with populations that may have trouble affording dental care. So that's kind of what led me to picking where I wanted to go to dental school, residency, and things like that was trying to help out people who otherwise may not be able to get treatment.
So kind of like almost an emergency clinic you were working out, but just helping people get out of pain and kind of not much more than that.
Right.
Not dealing with
Hmm.
all the other underlying issues and education, etc., getting on top of things. Yeah.
Yeah.
How do you find that kind of affects your workflow as this kind of insurance system? We don't have that over here. Everyone's entitled to that basic level of care, removing caries, periodontal disease, teeth that need to be extracted get extracted, and within reason, there is something we can do for everyone to get them kind
Right.
of dentally fit. Is that something that really affects the American population, do you think?
I think more so adults, and especially adults with possible, special health care needs. For children, at least in Maryland, it varies state by state. So the state that I live in has really good dental coverage for children up until age, I think it's 21, and for pregnant mothers up to a certain point. But for adults and adults that kind of who have special needs who age out of the children's program, it's very difficult to get things covered. I think they cover things like cleanings, and tooth extractions, but maybe not too much more than that for public, like state insurance. Private insurance, it's a little bit different. So it kind of just all depends on what insurance you have, which is unfortunate.
Right. So is there different kind of levels or types of insurance in America?
Yes. So there's state-run insurance, which covers, a lot of things for children, basically everything for children.
Yeah.
And there's state-level insurance for adults that covers things like cleanings and tooth extractions. But then, depending on what company you work, they work with different private insurance companies. And so what each private insurance company covers is a little bit different. Which can get confusing at times.
Yeah, I'm already getting a little bit confused, but so basically you've got quite a very basic level of care. Yeah, so a very basic level of care, and then anything maybe a little bit more complex or interesting, should we say, is more on the private side of things, or private insurance-based sort of things. So,
right.
Okay, I'm moving on from that because I'm definitely going to get really, really confused there. Is it different to what you'd expected kind of going into dental school? I know you've kind of come from a different side of things. For us, we're just like, oh, I want to be a dentist, and we do a couple of weeks of work experience, and you kind of just watch. And then you dive into a 5-year program. There's 2 years of lectures and then 3 years on the clinics. And you're like, oh, this isn't what I expected. I didn't realize we had to do X, Y, Z and that sort of thing. Did you find the same sort of thing? Were you kind of more prepared to what the actual job's going to be like?
I think yes and no. I think, I did the same thing, some shadowing, but you're never really prepared for what it's going to be like until you have, that first patient in your chair, and you have to go through all of the kind of motions and everything with it. I think I wasn't prepared about how much I feel like I still have patients that I still think about, their treatment plans and what I could have done better, what I could have done differently. So I think from that standpoint, that wasn't what I expected, to have such a, I guess, emotional connection with dentistry. And also back when I was applying the technology and things and the pace that dentistry is moving, especially, general dentists with implants and things like that. We don't really do that in pediatric dentistry. It's just, I feel like, moving so quickly right now. That's something I wouldn't have necessarily anticipated.
Yeah, it kind of we're quite a fast-paced sort of group. I think we like to pick up the newest and snazziest sort of little bits of kit, and then realize it's not much use and try the next thing until you get something that kind of works. So were there any kind of weird alternative careers that you thought about kind of beforehand, and when you went into that undergrad sort of college life, thinking, oh, I might do this or that, or were you always health focused?
So this is why I don't know if I would have picked dentistry at 14 or 15. For a brief moment when I was a teenager, I really, really wanted to be a wedding planner. I don't know why, because I'm not, even when I planned my own wedding, I wasn't that involved in it, but I really wanted to be one. So it's probably
Have you watched The Wedding Planner? Is that?
It might have been. I don't know. But that was a very brief moment in time when I was like, I don't think I'd be good at that. But nothing too weird, just randomly that.
How do you kind of find dental school then? Because it's obviously quite an intense course. You kind of get thrown straight into it, don't you? How was your course structured, and what were the kind of the highlights and lowlights, as it were?
So I went to school at University of Maryland, which we do 2 years didactic training. You have your anatomy courses, your basic sciences, some time in the clinic just shadowing, and you have your 2 years of clinical experience. I would say it was an overall good experience. We are right in the heart of Baltimore, which is the major city here in Maryland. So our patient pool, we have a very diverse patient pool, which was good. We also had a special needs clinic right in our school, which was really good. So we got to work with a lot of medically complex patients, which is really good experience going out. And then our school has a big research component. I wasn't involved in research, but you're kind of around it, so you stay up to date on the latest technology and things like that, which I thought was a plus of the program that I wasn't really expecting when I first started there.
Oh, right. So it's quite similar to what we did. So we had 5-year course. The first kind of 18 months in were very heavily theory based. It was just anatomy, physiology, all that kind of stuff. And then we had a good 4 or 5 months of intense kind of simulation work on the phantom heads, doing stuff there. And then from that start of the third year, then you're on clinics kind of increasingly more and more different types of clinics. And so quite similar, I think, actually. So not as different as maybe I was expecting, but interesting to know how you guys did as well. What were your kind of what were your best memories from dental school? Like anything that sticks out, funny or just kind of like a really good moment or something?
Just being with friends in general, we would all study at the law library, but I had a group of guy friends that would like to prank us a lot, which was nice because it would de-stress. So we would be setting up for a patient in clinic and they would pop out from behind a wall and scare us, or we'd be studying late into the night at the library and they scare us then. So that was kind of something that was fun, silly, and kind of dumb, but it kind of helped to de-stress things and, give everyone a good laugh and things like that. So just spending times with friends.
Keeping it a bit loose. And kind of what was your big kind of like maybe the worst kind of part of dental school? What did you find the most difficult?
For me in dental school, it probably was kind of the long hours in the sim lab. I remember we had one denture lab where you had kind of like a 24-hour denture practical and had to turn it in the next
24
day.
hours? So like
it was like a very short amount of time to like make this denture, and I think I was in the lab from 7 a.m. until 1 a.m. just making a denture, and it was horrible. So that was the worst.
In my head, I'm seeing you guys get shoved into this room and just getting locked and like you've got 24 hours, get a denture made.
I don't remember. I mean, it was either 24 hours or something very close to that. But I was in the lab until 1 or 2 in the morning. It was awful. And that's kind of when I was like, I don't know if I can make dentures. I don't know if I can be around dentures again.
No, it's a bit of a mysterious art. The full dentures, especially, a bit of a mysterious art.
Yeah.
I think I'm getting there, but I'm sure patients have something different to say.
Yeah, they might.
Yeah, so that is something maybe I did notice, that you guys do a lot of kind of lab work, whereas we did kind of simulation work with phantom heads using the drills, doing practice endos and things like that, whereas you guys really hammer fixed pros work, removable pros work, making your own crowns, making your own dentures. We kind of went through it once, go, this is how it's done, but you'll never do it, so don't bother. And then we go, oh cool, and then we go and we send it to the lab. I send it to the lab, they'll sort it out. But I think that definitely gives you kind of a good step up. You guys are just ready to really go for the really nice high-end treatment as soon as you come out of uni. Did you kind of find that you went in and whatever patients are asking for, you were kind of like, yeah, I can do that. I know what I'm doing there.
I think for the most part, most of what, the patients that during dental school wanted, I think I could handle pretty well. And then in residency, it was pediatric dentistry. So mainly we're doing stainless steel crowns that are already formed, things like that. But there's always patients who, want different things, or parents who, now that, I work mainly with children, who may want different things. So you always have to kind of figure out how to improve your skills and kind of get ahead that way.
So maybe not applying so much to you because you went down the kids route. Yeah. So for current dental students, hopefully we've got quite a few watching. What's your biggest tip to them guys? What's the biggest thing you could kind of tell them to do or not do, watch out for, not watch out for? Obviously this will be quite US bent in kind of the advice.
Right. I would say, dental school, and I think this may be, and correct me if I'm wrong, wherever you go can be kind of like a pressure cooker if you let it, and really stress you out. And I think one thing I would do differently is, know when to take a break, know when kind of enough for the day is enough. Like when I stayed to the lab doing dentures until 1 a.m., I don't think my dentures were any better. I just didn't know, kind of when to call it quits for the night. So I would say it's okay to take a break, do something non-dental related for a couple of hours, or just, take a nap or something like that and come back to it with new eyes, because you can see a lot of things that you may have missed once you're, tired and things like that. If you come back refreshed, I think it helps a lot. And that's something I didn't really do, but I think would be really helpful.
Yeah, maybe we tend to get tunnel vision when we're in there, going, I'm just going to look at this one tooth and this one tooth, and you're missing the huge cavity on the 7 or something. So maybe one of those. So if you go back differently, having said what you'd said, go back to dental school, what would you do differently, essentially? Or would you all kind of, did you kind of go through the right?
I think just take it day by day. I'm the type of person who likes to plan weeks and years future. Take it day by day. Realize, at the end of the day, doing the best that I can. I'm still going to graduate, be a dentist. I'm on track. I don't have to, go crazy trying to figure out every detail. And I think that would help kind of make dental school, maybe the clinical years, a little bit less stress-free. So I would stress out about patients, treatment plans, and I think if I had just taken it day by day a little bit more, wouldn't have been so crazy those last 2 years.
Yeah, I think everyone kind of gets caught up in it because you want to pass, but then you forget that you've got someone who's really experienced there who you can just ask, go, look, I've thought about this. What do you think? And you don't have to kind of like kill yourself every night thinking, oh God, do I need to do this? Do I need to do that? There's plenty of people out there to ask. So that's definitely something. If there's guys out there, I know I answer questions quite a lot. I mean, I'm very new into the career, so maybe not the best person to ask, but I'll do my best. Anyone in pediatric dentistry or interested, would you be happy to kind of take some questions from those guys?
Of course, anytime. Pediatric dentistry, I feel like it's a very tight-knit community, so anyone who's interested, always happy to help and hear from fellow tiny teeth doctors, or those who would like to be ones.
And so kind of like you joined the club a little bit early doors. After dental school, what was the route for you? Because you guys, do you go straight into practice out in the real world, or do you decide to do further training straight away, or does it kind of depend?
So it depends. You can certainly, I had classmates that knew they wanted to be private practitioners, so that's where they went right away, and they've been very successful. I knew from starting dental school, probably the second year, I wanted to be a pediatric dentist, so I went right into residency, but you can do either one.
Yeah, so you kind of already knew you were going to do that. So did you apply while you're still in dental school, or was it a wait till you've qualified sort of job, or how does it work?
So the application opens up, I believe you apply over the summer over your junior year of dental school, and then you have interviews your senior year, and you find out on match day in January. So It's kind of like a year-long process of figuring out where you want to go. Kind of, we have hospital-based, school-based, and then hybrid programs. So kind of looking into different types of programs that you might want.
And for those guys who are interested in doing that, what are the things that they need to be doing either before dental school, within dental school, and kind of leading up to the end of dental school that they need to be looking at to build their resume or their CV, as it were? What's those little bits that they need to kind of tick off? What do you reckon?
I would say definitely, meeting with the pediatric faculty at your school, joining if there's a pediatric dental study club, doing that, going to the pediatric dental clinic. That's what I did when I didn't have a patient. I would be up there trying to shadow with patients, getting to learn, and also meet the faculty who may someday be writing you a letter of recommendation. Also in pediatric dentistry, they're looking more at you as a person rather than, if you're at the top of your class or things like that. So things like volunteering and all of that's really, really important.
Right, so kind of the same things you almost did before you went into dental school, I think, just kind of more of the same, maybe a little bit more targeted in the things that you're shadowing and the clubs that you're joining. And then obviously once you get in, you go through the residency program, there'll be more exams, etc., etc. And when you kind of get out, what are the kind of things that you've been doing that you're doing day to day that's kind of making your day good and etc., things like that?
So I'm at a group practice right now, which has been really nice since, this is my first time really ever working in the real world as a dentist. So I'll talk about cases with my colleagues, which has been helpful to, review and get better. But it's more, I'd say the patient load increased significantly from what I saw in residency. So that's been good. I mean, the day goes by very, very fast, and I love working with the children. So it's been good. It's been a good transition.
And what are kind of the most common issues your patients are having that you see? In the UK, we have a big issue with young children, kind of rampant caries, having to go under for general anaesthetic. Not only is that very dangerous for them, but Obviously, general anesthetic comes at quite a high cost. It's actually one of the biggest costs in healthcare in the UK, which for some reason no one's looking at, but simple prevention would help that. Is there something similar in the US, like a certain thing that's just the elephant in the room going, why are we not dealing with that?
I would say for kids, it depends kind of in certain pockets you'll find rampant decay. I definitely saw more rampant decay when I was working as a resident than kind of out in the suburban population.
Yeah.
Just a little bit different. There still are patients with rampant decay, but I think just educating parents and pediatricians in general. Here we like to say first visit to the pediatric dentist by first tooth or first birthday. So we get a lot of new patients that are 3 that already have some decay, whereas if we probably would have seen them, when they were 1, that wouldn't happen. So I think more of just increasing education to try to prevent those rampant caries.
So let's pretend that I'm a new parent. I'm not, but let's pretend I've got, one in my, here we are. Okay.
There you go.
What are you telling me on my first visit to the dentist with my child?
So on the first visit, we'll do what's called a knee-to-knee exam.
Yeah.
So you'll lay your child in my lap. We'll look at the teeth. So we look at the teeth, what teeth are in. Are you kind of at age-appropriate milestones for getting teeth? We talk about toothbrushing because we like to promote brushing with a smear size of fluoride toothpaste as soon as the first tooth comes in. So we talk about nighttime routines. Diet is a big one. Bottle usage is a big one. So it's mainly for the parent to kind of feel comfortable and go over their, routine and educate them. Yeah,
in the UK, we've got like a couple of different formulations for toothpaste. Is it the same in the US? Obviously, the adults is over 1450 ppm for fluoride. So what are you kind of advising for the kids? Or some dentists over here will say just use a small amount of the adult toothpaste. Some of them saying get one with the 900 and just give a pea-sized amount or a smear. Are you saying similar things?
As far as I know, I'm not sure actually if there's a difference in children's and adults. We typically just recommend using the smear size, whether it's children's or adults. Usually we say children's for it just because of the flavor.
Right.
And not to use training toothpaste once the first tooth has eroded, because in here the training toothpaste has no, fluoride in it. So if the child were to get any the whole thing, there wouldn't be a concern of toxicity, but here we just have a very small
low dose one, yeah.
That's a good
question. Thanks. And then in terms of bottles, are we talking free flow and metered? Or was it not metered? The one where you have to suck it. I'm not sure what you would call that. Free flow is where it pours, isn't it? And then the other one, the baby has to suck.
I know what you're talking about. I'm not sure the official name.
Yeah. Is that similar things that you would kind of warn them about before they get on to kind of giving them juices and hopefully not juices, but, milk in a cup and stuff like that?
Yes. So our main concern with the bottle is a child being put to bed with a bottle filled with milk, or, I've had people put chocolate milk in the bottle, juice in the bottle, because then sugar sits on the teeth and that'll cause the decay, the baby bottle tooth decay. So that's where, talking about nighttime routines and seeing what parents are already doing is really important. After age 1 to 2, we start talking about using the different kinds of cups and things like that.
Yeah.
But for the bottles, we really try to get them to not send them to bed with a bottle, or if they absolutely feel like they need to, a bottle of water or something like that.
Yeah, I tend to say maybe some water or some plain milk, and that's pretty in the grand scheme pretty harmless. So you've done that kind of early prevention side of things. When they then come in, they're starting to get do you call them D's and E's in the US? So primary, secondary molars. So the primary molars coming through at that stage. What you kind of starting to tell the parents, and what are the things you're looking for?
So when they're starting to get all of their primary teeth, we're looking for, are they getting crowded? Or is there spacing in between the teeth? And more about, foods. What kind of foods are they eating? What kind of foods are they trying? Things like that. Kind of getting more into their diet, because a lot of kids, that I see eat the fruit snacks, eat things that are high in sugar. So just kind of getting on that, talking about those are biting surfaces of the teeth with deep grooves that are susceptible to cavities, unfortunately. So it's really diet and education for a lot of patients.
So yeah, that's quite similar. We have diet history sheets they have to do. In one place I've worked, it was 7 days. Another it was three consecutive days, but one of them had to be a weekend day to kind of get that range of what's happening at school, what's happening at home. Are those things that you're also doing as well, just to kind of get parents to think about what we're eating and when we're eating it?
So I wish we had a paper form. That sounds like a really good idea. I usually just ask, what does lunch look like for you guys? What does a school day look like? What does your dinners look like? Trying to get the information that's on that form. But, parents will tell me what they eat at grandma's house is a lot different than what they eat at my house or what they eat at school. So it's just trying to get as much information as you can. But those forms sound really nice.
Yeah, I'll send one across to you once I start back up at work. I've got a couple of weeks off, but remind me and I'll get that sent across. And anyone else who wants that, then just send me a message and I'll get something sorted. The other thing that I was thinking to ask you is more along the sides of radiology for kids. So what are your kind of rules that you're using over there? Is there any guidelines that you think are useful? Obviously that's going to differ country to country. When you're taking your first bite wings, are you taking OPGs or panoramics as a checking for development? Some places do, some places don't. What are your thoughts?
So I will say, I'll tell you kind of what we have. We have the American Academy of Pediatric Dentistry has guidelines, and they have a really good radiographs guideline that kind of shows you for a new patient, returning patient. For patients, for bite wings, for example, if their contacts are open, so if you have a 4-year-old with a lot of spacing, I can visualize the contacts. I'm not going to take, bite wings. But if the contacts are closed, if they're low risk, maybe every 2 years. If they're high risk, it may be yearly. And it just depends on the risk and kind of what I see at my clinical exam to determine what x-rays I may need.
And when you take your first bite wings, that's always a interesting question because it seems to differ very, very significantly when you talk to different people.
I think it's based on, and I think it will just because it's based on what you see clinically and what you see with the contacts and of course the behavior, because I don't want to take bite wings on a child who's not going to be successful because the diagnostic information that I get won't be good anyway. So it's kind of with kids, it's all those factors that you have to consider before you attempt to take the first bite
before
wings.
Throw that little thing in there and they start crying.
I know. It's not easy.
In fact, on that note, what's your little tip for getting the bite wings taken quickly, quietly, and efficiently without having the tantrum?
So what I try to do is kind of give kids enough information that they know kind of what they're going to feel and what they expect. So we talk about how breathing through their nose can help because that'll help settle the tongue and won't make them feel like they're going to, gag or anything like that. We try distraction, like playing Simon Says or wiggling their fingers, things to get their mind off of it. Jazz hands.
I'm breathing through my nose.
Just trying to give them some information you're going to feel. One of the assistants where I work says they're going to bite down on a little cookie. So she'll explain it that way. Just kind of using their imagination to help them cope with that experience. Of course, you'll always have some kids who you could do, all the distraction all day. It's still going to be a difficult bite wing, but I find that helps.
Fair enough. And then to the panoramics, so I cut you off before.
No, that's okay. So for the panoramics, that I think is a very helpful x-ray for when you're in, mixed dentition, when you have the 6-year molars, the laterals, the centrals that are all permanent on the top and the bottom, to kind of see the positioning of the adult canines, make sure that they're, at an angle to come in, look for any, missing teeth, see if there's any development of the thirds. I think it can be very helpful. I think just timing of when you're going to take that picture will depend on a child's dental age and again
so you're looking for those little landmarks, the first molars poking through, and you take those as a routine X-ray then?
I would say I take them frequently, I would say more often
Mm.
than not, just to, see if there's anything oral pathology wise, look at the symmetry of the condyles, the
Yeah.
shape of the mandible. It can give you a lot of, I think, good information.
Right, that's interesting because we don't tend to take the panoramic as frequently as in the UK. Part of that is a lot of the places don't have a panoramic machine in the surgery, so a lot of the time those kind of patients get passed on to specialist clinics. So maybe they would take those in those cases where you're thinking there's a lot going on. But yeah, well, I haven't tended to take so many unless I think there's some caries and we can't get some good bite wings taken. So that's quite an interesting difference. I think in some countries as well with adults, people take, new patient pan, which we would take bite wings and just check on things like that, a little bit more radiation aware maybe, or averse even. Orthodontics, obviously that's kind of a parallel profession to your own. What kind of relationship do you have with those guys? Do you tend to have quite a close relationship? Obviously, you might be dealing with hypodontia cases, etc., or the interesting ones. What happens in those situations? Do you have like multidisciplinary meetings, etc.?
So the area that I work in is really great because there's a lot of really great orthodontists in that area. So usually in the practice that I'm working at, currently we do the space maintainers, we'll do band and loops, we'll do Nance appliances, lower lingual holding arches, things like that. But for the full orthodontics and, if there's supernumerary teeth or canine that may need to be extracted, we'll let the orthodontist, give us the extraction order for that. So they're kind of in the driver's seat in terms of
Driving
the full
plan.
plan.
Yeah.
I would say. But then in other offices, I know they have pediatric dentists and orthodontics that work in the same office.
Yeah.
So it just kind of depends, I think.
Okay, so for a general dentist, what are the things that you want us to be looking for? First of all, with kind of caries, etc., but also with the orthodontics. At what point are you going to tell us, all right, something needs to be done here?
So I think in terms of caries, I think always, being on the lookout for signs of caries, initial signs of caries, especially, where the teeth touch together and on the occlusal surface, lifting the lip for first dental appointments for babies to look there, and then taking radiographs and trying to get, the appropriate radiographs for kids. Yeah. Another thing I'd say is important for general dentists is to think about, kind of restorative materials for kids. We use a lot of stainless steel crowns if there's large caries.
Yeah.
And that sometimes is a better material than using composites. So I think being aware on that end is really important. And then for the braces, I would say if you have, a kid with a posterior crossbite or an anterior crossbite in the primary teeth, and the permanent teeth are coming in, they're still going to have that. I would say that's something you really want to be on, and would probably be really a referral to an orthodontist just to have a look. Things like that you see in the primary dentition that once they start to get the permanent teeth in will be a problem down the line.
Do you guys use the aesthetic score and the IOTN over there? Or is that more of a UK thing that we tend to use?
I'm not familiar with it.
Right.
So I can't say for sure, but for me personally, I'm not familiar with it.
So we kind of have a classification system. It may well be an NHS thing, but I did wonder whether you guys used it or not. It just kind of goes through severity and kind of how bad something looks on the aesthetic side, and then the actual if it's impeded eruption, it might be 5I or something like that, or there might be a crossbite, which would be an X, and then you've got all sorts of different, contact point displacements, and then they give a different number for those. But no, that was just a thought that came into my head to see whether you guys kind of use the same sort of classification or not.
No, I mean, not that I'm aware of that we would use for referral purposes or to know when to refer something. But that doesn't mean, somewhere else that they may not use something similar. I'm just not as familiar with it.
Okay, fair enough. Do you guys have something of that nature at all?
Not that I'm aware of, no. But again, there may be.
It's different everywhere. Yeah. In terms of your work on a personal level, what are the things you're doing to improve the quality kind of day by day or kind of a rolling sort of time period? So the things that you're doing to kind of review the things you're doing, go, I could do this better, I could do that better. Have you got a system?
So I like to, at the end of each day, kind of review the cases of the day, and I'll write in my little paper chart, kind of put a star next to ones I kind of want to go through again. And I think that's a really good way to always be self-assessing. And then, like I said, I'm in a group practice, which is nice. So I can say, this is what I did with this case. What would you do differently? What would you have done? That's been really, really helpful to help me grow and learn, and also kind of review. I think being able to put your work and yourself out there, I think, is an important way to grow.
Right. So, I mean, it's probably different to kind of the restorative side of things, where I would tend to take loads of photographs and stuff like that, and then just like zoom in on things and go, ooh, looks a bit, needs more polishing, zoom back out. And it's similar things that go on in kids' dentistry as well.
So there's some pediatric dentists, actually another doctor in my practice likes to take a lot of clinical photos. I want to start doing that. I need to kind of get better at my dental photography skills. But I think that's a really good way to also, if you take radiographs every 2 years, you may be seeing your work at that time. And then clinically every 6 months when they come in, you'll be taking a look at it. But I think, photography is definitely a great way to, kind of instantly see things that you may not see with just your eyes.
Yeah, so that's quite interesting actually, because it's always interesting to hear what other people are doing to kind of step up the game and kind of take it to the next level. On a similar sort of note, what are your kind of next steps in the profession? What do you see yourself doing in the next 5 and 10 years?
So definitely, I think the group practice setup is good for me. So I'd like to stay in private practice, but I'm also really interested in teaching. I liked all of those experiences when I was in dental school. So I'm going to start spending time back at the dental school in the pediatric department, helping teach there, which I think is nice. Yeah. So, getting more involved in that, and then just, learning more, taking more CE, and just trying to become a more well-rounded pediatric dentist, I think, kind of my first 5 years out.
Okay, fair. Yeah, I think probably similar to a lot of people in that situation, just find your feet a bit and then add little bits in as you go along. You said you had a few tips for general dentists, kind of to do with trauma, maybe behavior management, and maybe importance of baby teeth, but that would be more kind of geared towards parents. Maybe I would hope we know, having gone through dental school. But what are your tips then for the trauma side of things to start with?
So for the trauma side of things, I think it's important to always take a really good history. For a kid who comes in with trauma, always ask about, who, what, when, where types of questions. Always make sure you rule out if they have a concussion, anything like that. And then just kind of knowing what to expect, because treatment for trauma differs if it's a baby tooth versus an adult tooth. For example, if you avulse a baby tooth, you're not going to put that back in. But if you avulse an adult tooth, then you have a very short timeline window that you want to get that tooth back in. And then always, if a kid has a hits their chin, you always want to check, to make sure the condyles are okay and things like that. So I think getting a good history and kind of being comfortable taking the radiographs you may need for trauma, I think, is really, really a good skill that a general dentist could have. What
are the most common, maybe not mistakes, that you've seen, because obviously you're quite young in the profession?
Yeah.
I'm jumping over my words there. Similar to myself, but maybe that people who are a little bit more experienced have told you, look, this is what we might see from a general dentist, and we're going to have to sort this out. What are those kind of bits that we miss? Obviously, we'd rather not miss them.
Right. I think general dentists can do a great job, because I'll just start with that disclaimer. But I think, again, thinking about, behavior management with kids, restorative dentistry with kids, the types of materials. Like I said, the stainless steel crowns are used at least in America, very commonly for large cavities on posterior molars, and I've seen
Yeah.
some, large cavities covered with composite, and then you get the recurrent decay and things like that. So I think just thinking about restorative dentistry for pediatric patients as being something that's different from adults. And so not everything that's done with adults will work with children.
We tend to use a lot of glass ionomer. Yeah, we tend to use quite a lot of glass ionomer. Is that something that you are in favor of, as opposed to using a full-blown composite restoration?
I think glass ionomer can be very good. I think it's a good diagnostic tool almost when you have a tooth with deep decay and you put a sedative filling with glass ionomer, and then you wait and see, is the tooth going to be stable, or is it going to then, have irreversible pulpitis, and this is a tooth that we could pull. So sometimes in residency, we would place glass ionomers and kind of wait and watch that tooth for about 3 months.
Right.
But I also think, if you need a temporary filling, or the kid has a deep, cavitation, then you can kind of scoop out the soft decay and put a glass ionomer over, especially for really young kids. I think, that's helpful.
Okay. And behavior management side of things, where do you start?
Where to start with behavior management. So I think, we have things like tell, show, do, where I'll tell a patient what we're going to do. Like, let's say we're using an Explorer. So I'll tell them this is my tooth count, or show it to them. And then I'll count on my hand with it to show them how it works. And then I'll do it in their mouth. So things like that are helpful. Imagery is really helpful. When you're cleaning out a cavity with the high speed drill, you can say, this is my water brush. You're going to hear it whistling. Things like that describe more of the feeling than what's actually happening, I think, are helpful. We also use nitrous oral sedation, like you said, if it comes to it, then general anesthesia, unfortunately. But that's not where we would go first.
Yeah,
obviously.
Yeah. You try and get things sorted before, with the least amount of invasive procedures possible. Yeah. And then very quickly, importance of baby teeth for any parents listening.
I'm sorry.
For any parents listening, the importance of baby teeth, because I've heard this, from some patients where they say, or other their parents say, but it's only the baby teeth, they don't matter. So what's your thoughts?
I think they're very important. Baby teeth are important because they hold the space for your adult teeth, which is very, very important. They, help you form words, the front baby teeth. Having baby teeth that don't hurt kind of helps kids feel better about themselves. It helps them go to school. They're not distracted by pain. And, I think, any infection that's in the baby tooth that then gets down into the nerve and causes infection in the bone can hurt the adult tooth. So I think baby teeth are really, really important. And yes, they fall out, but while they're in the mouth, they're, a vital thing that we need to help preserve, arch space and all of that. I love baby teeth.
Touching on school there, actually, I did hear one kind of story, anecdote a little bit, where someone, little one was in pain for quite a while and they couldn't quite work out where it was coming from. When they eventually did remove that tooth, I think it got to the point where they just wanted a shot of it, essentially. But kind of the behavior in school picked up, and grades, all that kind of thing. Is that something that you see more regularly? Obviously, you see a lot of kids. So is that something that you're kind of aware of?
Yes. So when I was in residency, I had a patient like that who came in. His face was swollen. He had been in pain, and he wouldn't smile. He wouldn't look at you. He wouldn't do anything. So we brought him back after, gave him a course of antibiotics to get the swelling down. We brought him back and we took the tooth out, saw him for a follow-up, and he was literally a different kid. He was happy, would look me in the eyes, was smiling. So, kids know what's going on. And I think it's in our best interest when they're in pain, even if we don't see anything, to kind of listen to them and help them figure it out.
Okay, yeah, that's a lot of, would you say pediatric dentistry almost borders on more of a psychological side of things as opposed to just the dental side as well?
I think so, kind of in a way, just the way that we talk to kids and the way that we interact with them and try to make it so. I always think when I see pediatric patients, it's kind of my job to get them ready to go to the general dentist when they're an adult and not be afraid of the dentist, not have those Really some people have deep-seated fears of the dentist, and so it's my responsibility to try to make it a positive experience so that when they do go to the adult dentist, that they're not scared and they don't avoid dental care and things like that.
Yeah. Um, what almost what do you think they obviously we all see some quite hilarious children, and they say all sorts of different things. I've had some where I was actually seeing the mom, and then I'd asked her, "Do you drink alcohol? Do you smoke at all?" And mom had gone, "No, no, no, zero alcohol, zero smoking." And the little boy in the corners just shouted out, "Oh, but what about that pack of 20 you had last week?" And stuff like that. Do you get a lot of different things? What's kind of the funniest thing that you've heard come out of a kid's mouth?
Just a lot of different things. I had one kid that we put a stainless steel crown in, and the next time I saw him, he told me that he could see the moon in his tooth. Like, they're just saying such funny things. And I had one kid dressed up as Spider-Man, and he would tell me every time that Spider-Man was coming to his dental appointment. They just say whatever on their mind. They will
Mm,
say things, parents will say things, and then the child will correct the parent. One little girl told me that her dad used everyone else's floss and everyone else's toothbrush, and I was like, I don't know if that's true or not. That's a really weird thing to say. So just anything you can think of,
yeah.
they say.
You get
But
quite a few with the, "Oh no, we don't give him any sweets. We don't give them any sugary juice drinks." And they're like, "Mom, do I still get a Coke when I get out?" And he's like, "Really?"
exactly,
um,
kids are very honest. They're very honest. I have to give them that.
yeah.
They're honest.
What's kind of your favorite thing that a child has said to you after you finish some treatment, kind of just like hit you to the core almost?
One little girl, we just finished, we had to do kind of 4 quads of dentistry at the last
Mm,
appointment. She gave me a picture that she drew of me and her, and that was just, that just really touched my heart because she, took her time to make that, and it just, I don't
mm.
know, it really, really touched me because it was something that she took time to do, and just made me feel good. It was really sweet.
Yeah, so I think you'll get quite a few of those in working in the kids. So they're always quite good. I actually left a practice for those guys who've been following me on Instagram, etc. Then I left my current practice. I'm starting up in a new one. I took two teeth out on a little 9-year-old girl, and she cried. But then what I didn't
Oh,
expect was when it was time to kind of get up and go, the mom was like, "Oh, you like him? He's leaving. Do you want to give him a hug?" And I was like, I did not expect that. And she's just like, I was like, "Ooh, wow." I didn't expect that at all because I've only seen her 3 or 4 times, and it does kind of hit you a little bit. So yeah, uh, maybe don't
that's
want
nice.
to. I definitely wasn't expecting. It was like, wow. You really think how much you're impacting someone there because obviously she'd been in pain and she realised that we'd sorted her out quite efficiently and quite well. I hope. Um, Moving on from the dentistry though, what are the little bits that you are doing kind of outside of work in your free time? What are the things that you gets your mind off work? I know you said you tend to overthink a little bit, think to do the
Yeah.
right thing. So what gets you out of the zone?
So I really like being outside in nature, so finding new places to go hiking. We have a lab, so taking her outside is always really fun. I like
Mm.
traveling. We recently came back from Italy, and now we're trying to plan our next trip. So that's been a lot of fun. And then just hanging out with friends and family and trying new restaurants and things like that. Just anything to kind of, get away, get out to a new place
Mm.
or out in nature, I think is really important to help me kind of clear my mind and things like that.
Did you go to Rome when you were in
I did.
Italy?
I went to Rome.
Because I'm going
Yes.
tomorrow, which is
You're going to Rome
yeah,
tomorrow?
massive coincidence there. I didn't think this was going to come up. Yeah, what things should I be looking out for in Rome then? Bit of
we we mainly did the big things like we did the Colosseum. There's a
mm,
restaurant right across the street from the Colosseum that you can eat at night and watch the Colosseum be lit up. That's really cool to
okay.
see. Uh, there's a main square. There's really good gelato everywhere we went around there. It was really good.
It's kind of Italy's thing, I
Um,
would have thought. Yeah,
yeah, that's true. You can't go wrong really anywhere.
yeah.
Really good food in Rome.
Mm.
Really good food in Rome.
No, so you do a lot of photography. What kind of things are you into? with your photography? Is it just landscapes, or do you take different types of photographs?
Mainly landscapes. I
Mm,
mean, I'm not as proficient with it. I got a Nikon,
right.
and I'm trying to learn how to use it, but mainly landscapes at this point.
Okay, nice. I suppose you can maybe use that in work as well at some point.
That's what
Uh,
I'm hoping. I'm hoping to get some lighting and then take it to work
yeah,
and take some good.
that's what happened with mine. I bought, same as you. I bought a Nikon 5600 D6 5600, but I bought it really early, just as I finished university, and I had a good 10 months off. So I was like, oh yes, I'm buying this for work, and then I went traveling.
Right,
I took loads and loads of photos, and then I have used it for work, but maybe not as much as I should.
right.
But definitely, it's a great hobby to get into, but a little bit
Yeah,
expensive, really, isn't it? There's so many things that
yeah.
you can get, and oh, I need that
Hmm.
now. Oh, I need that now. Do I need this? Do I need
Right,
that? Yeah.
right. Totally
Um,
get it.
where's your next trip planned to then?
We haven't settled yet. So my husband really wants to go to Ireland
Mm,
and England, and I really want to go to Japan. So
that's completely
I
opposite
don't know
end of the
where we'll end up.
spectrum, isn't it? Yeah. Does he have
Yeah.
some Irish blood or something? Is that why he's keen on going? Yeah.
Yeah.
It's
He
quite
wants to
common
go
it's
see.
quite common over there, yeah.
Hmm.
No, definitely come to the UK, that's what I'll say. Yeah.
Yeah, that's true.
Uh, so other than those little bits and pieces, spend time with friends and family, that's kind of what everyone would say, I suppose. Anything that's kind of out there that you do that gets your mind off things that maybe is a little bit more quirky.
Um, Gosh,
We're digging deep here.
I don't know. I can't think. I don't know if I do anything quirky. I'm gonna have to think now. Do you do anything quirky to get your mind off dentistry?
Uh, probably not, to be honest. I mean, a lot. I've been doing a lot of the Instagram stuff, so maybe that keeps my mind off things. I get to talk to loads
Yeah.
of different people. That's maybe something that I've quite enjoyed. I suppose that's a little bit quirky. It's not an everyday sort of thing that
Yeah,
everyone's
sure.
doing, but yeah,
Why not?
yeah. So nothing really there then. Right. So we've got a few. We've got a few kind of fun questions towards the end. Uh,
Okay.
do you have a favorite conspiracy theory?
Yes. So I do. I answered that probably a little bit too fast, but there's an airport in Denver, Colorado, and there's a lot of conspiracy theories around that.
Yeah.
So a lot of people think it's owned by the Illuminati and that there's an underground city underneath for when the world ends. That's where all the members of the Illuminati are going to go. There's also a blue horse statue outside that people think is like looks like kind of like a devil horse, and it actually killed its sculptor, so people think it's like possessed. So that's probably my favorite conspiracy theory, just because I've never heard of so many conspiracy theories around just an airport,
So this
which is kind
airport,
of weird.
it's got a city underneath the airport.
Well, that's what people think. I'm not
Right.
sure, but people think that it does, and then there's all these weird mosaics there, or paintings there. There's a bunch of weird stuff about. There's
Just
like 20 different conspiracy theories just with that airport,
so
which
around
is
this
weird.
airport, there's been a whole kind of like mythology set up. That's crazy. That
Hmm.
is.
I
Uh,
know.
wow. I don't even know what to say to that.
I know.
Um,
It's bizarre.
yeah, that's a good one. That's a really good one. The next question that we're asking everyone is, what's your pet peeve? The thing that really winds you up. And this doesn't have to be something within work. It could be outside work, anywhere. One really,
Um,
really kind of innocuous thing that just really grinds your gears.
I think when people tap their pens or their pencils really loud, I don't know why, but that like tapping noise,
Mm.
it just really bothers. Like even now, just talking, it really bothers me. But I never say anything to anyone about it because I'm like that'd be totally crazy if I just flipped out over them
So
tapping their pen.
when did that start? Was this you sat in an exam and there's a guy next to you just going smashing his pen
You
down?
know,
Is it?
probably.
Mm.
I can't remember one instance, but I know at least in college we took written exams. So probably at that time when I was trying to really focus and someone just was attacking their pen or pencil, I don't know. But
Right.
yeah.
Yeah, I can see how that would be annoying actually, just that incessant sort of click, 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 click. It needs to
Exactly.
stop. It's like the ticking of clock. Some people just hate it.
That's
I hope I've
true.
not started another one there for you. So imagine we were to finish this interview and you step outside and you find a lottery ticket on the floor and you've won like $10 million or something. Do you continue? What do you do? Do you continue with work or are you off on a long, far-flung holiday for a couple of years?
No, I think I would continue working. I really, really like pediatric dentistry. I really like where I work and the patients. I would probably do more traveling. It would enable
Mm,
me to travel more. It would enable me to get rid of my student loans, which would be really helpful. But I would probably still work and just add in traveling, maybe do submission trips. That would be something that I would be interested in.
mm.
But um, I think, work is nice and it keeps you busy. It keeps your mind active. So
So what do you do with the
I'd
money
probably do
then?
that.
Let's hear the
What would I do
let's hear
with
the
it?
juice. Yeah, let's hear the juice.
Um, I would probably pay off my student loans. That would be number one on the list. And then probably, if anyone else in my immediate family had student loans, pay off their student loans. Not sure if they still have them or not. And then go on vacation, probably. Actually, maybe to Ireland and Japan in one trip.
At the same time
I don't
somehow.
know. Yeah, at the same time. I don't know because it's just so much money. I don't even know.
Mm.
I don't even know what you would do with that. I mean, what would you do with $10 million?
It's one of those where you go, is it enough that you don't need to work, or are you going to blow through it and you still need to work? It's one of those. I'd probably invest it. I think that I'd have some fun doing some little projects, um,
Mhm.
and probably fail quite spectacularly with them, and then just continue.
That
um,
is true. I mean, you don't know if they will last you your whole life.
yeah, because these guys, athletes and stuff, they have huge pay packets, and then you hear they're all broke after about 2 years after they finish. Um,
That's true.
Another good question. You're throwing a dinner party. Who are the four people you invite and why? And this could be absolutely anyone, dead or alive.
That we're alive.
Probably more well-known
Um,
people because we're not going to know your mom and stuff like that. So,
that's true. That's true. I would invite Stevie Nicks from Fleetwood Mac because that's my favorite band. I think she's just the neatest person in the whole world. Who else would I invite? Probably all of Fleetwood Mac, but
we'll take them as one of the four then.
okay, one of the four. Probably Michelle Obama because she just seems so interesting and cool
Mm.
and hip, and we probably have some really good conversations. Ellen DeGeneres because she's really funny and would probably, keep everyone laughing and things like that. And then my last one, mm, golly, I want to say James Corden because I like his in-car karaoke, but I don't
Yeah.
know. But
Would he
that's
would
like
he
the
fit with
first
that
name that
group?
popped in.
Would he fit with that group? Do you think?
Huh?
Would he fit with that group that you've set up there?
That's what I mean. I don't know if he would be kind of the odd man out, but for some reason I kept thinking him. So clearly I want him at my dinner
So you've
party.
got two very, very good presenters, maybe throwing the banter around, someone singing in the corner.
Right,
And who's the
right.
other one that you had? Michelle Obama telling everyone, inspirational stuff.
Exactly. Exactly.
Okay, fair enough. Yeah, I think that's kind of the bulk of the questions I was going to ask you. Anything you've got for me?
I'm kind of curious. So you as a general dentist, what advice, and I'm sorry, I'm going to go plug my phone in, but what advice do you have for pediatric dentists? Because you see, adult patients that we maybe saw as children. So what would you recommend for pediatric dentists as a general dentist?
I think it's quite an interesting question. It's going to be a very different answer to maybe guys in the US, what you would kind of get from them. Because I,
Uh-huh.
I see everyone. So I'll see from birth to death essentially that's my patient cohort. And then the
Right.
difficult ones, that's the ones that we send out. So it's a bit of a different system really. Whereas you
Uh-huh.
guys, you go and see the pediatrician and then you go and see an adult dentist. So For us, I think we had a study day, a CE day, as you guys call it, and I asked a similar question actually, but the opposite way around. So I don't think I have a good answer for you because I probably need a few more years' experience. But maybe from my point of view, I would want more guidance as to what things they definitely want to be seeing and when, because I think we tend to maybe refer things a little bit too late. MIH cases, things like that. I think we get a pretty good handle on those. We send them as soon as we kind of see the molars coming through. But the more maybe malocclusions, things like that, I don't really know when the best time is to send them. In the UK, we do quite late referrals. So when all the adult teeth are through, then we send it for referral. We don't tend to do so much interceptives, kind of orthodontics. So that would be quite interesting to kind of get some more clarification on, I suppose.
That's kind of an interesting perspective. I mean, I know general dentists here do see some pediatric patients as well, but it sounds kind of similar things of when to refer. I feel like that's always a question.
Yeah.
And then I had one more question for you. What's the weird, because you see adult patients, so I want to know what the weirdest thing or the most bizarre thing an adult patient or any patient has said to you, or if you have a funny story about a patient of yours.
I've been threatened to be bitten before. That was an interesting one.
Oh my gosh.
Lady
From
stormed.
an adult?
Yeah, she was like 45. She storms in and she's like, "You're gonna sort me out. You're gonna do this. You're gonna do that. If you don't do it right, I'm gonna bite you." I was like, "No, you won't. I'm not gonna see you." Essentially.
Yeah.
And then she just quietened down a little bit. I was like, this is my first week of working after dental school as well, so I was like a little bit green. But I was like, oh God, what have I got myself into? So we had that one. But to be honest, most of my patients have been really, really good. We have the odd one here and there who's a little bit angry about having to pay up front with things. But I think that's kind of the way I say it to them is, you pay up front for a flight, you're going to pay up front for your treatment as well.
True. That's a good way of phrasing it, though. I mean, it makes sense.
My patients have been on the whole pretty good, really. They do say some funny things. Try to think off the top of my head. You tend to get a lot of life stories. You sit them back, and then it's like they're in the therapist chair, and kind of everything that's worrying them comes out. So I probably can't share some of those things, but that's quite that is quite one of the good parts of the job, I think. But yeah, probably the biting one's the one that comes to mind. Going, that was an interesting day.
Yeah, I'd say so.
Yeah, that was a little bit of a shock. It's like, okay, I've got to really have my head screwed on.
Yeah.
Anything that you wanting to plug? You've got your Instagram, which I'm going to pop in the comments, the description underneath the video, so guys can come and follow you, ask you questions.
Sure.
Anything else that you're plugging? The last lady, obviously, she had a blog that she was doing. So have you got anything along those lines that you want to drop in there and talk about?
I wish I did blogging, but I don't. I recently started a all pediatric dental focused Instagram that's more geared towards like parents and even, dental students looking for pediatric information, and it's small teeth _ big world. And so that's pediatric only information that's, can be used to share for just general knowledge.
Yep.
But other than that, that's it pretty much.
We'll stick that in the comments, not in the comments, in the description below. So guys, make sure that you're definitely following Jordan, and thank you for coming on. It's been a pleasure. Some really interesting things that we've gone through there. I think I have to say, please comment, like, subscribe. Is it like, comment, and subscribe? I've still not got the hang of it. But thank you everyone for joining us, and stay tuned for the next episode. It might be another week or so as I'm going away, as we spoke about, but we've got a couple of really good guests lined up, so stay tuned, guys.